Katharine Ligon. Did I pronounce your name correctly?
Ligon. It's not that fancy. People try to make it fancy. Again, my name is Katharine Ligon. I'm the Mental Health Policy Analyst with the Center for Public Policy Priorities. And I appreciate the opportunity to testify before you today to specifically address the budget items related to mental health and substance abuse. First, I would like to provide you with a bit of perspective about the spending of mental health in the state of Texas. As you've likely heard, recently Texas spends considerably less per capita on mental health services than any other state. The national average is about $121 per capita, while Texas spends about $39. What's most disconcerting for the center is that we're so far from the average, and so the concern there is that we do fund crisis services, and we do fund crisis services quite well. But that leads to limited community mental health services, which creates a double-edged sword by creating de facto systems of services being provided primarily in the jail system, the emergency rooms, and other hospital settings. Crisis services are expensive, and they're only a short-term fix to a long-term need. Second, I would like to talk with you about the expansion of Medicaid under the Affordable Care Act, as it has substantial potential to positively impact individuals with serious mental illness and substance abuse disorders, and therefore will significantly affect the state budget. In Dr. Lakey's testimony yesterday, he stated that 70% of DSHS GR is for mental health services. Additionally, city and county officials, healthcare providers, economists, and chambers of commerce have noted the very large potential economic and social benefits to Texas communities if Texas expands Medicaid. Expanding coverage for this population would ensure a coordination of care for a population that is currently undertreated or not treated, which reduce local costs associated with treating individuals in those de facto systems. A couple of other noteworthy benefits for Texans with mental health and substance abuse disorders would be with the Affordable Care Act does require that Medicaid coverage for children up to 26 who are currently in the foster care system, who age out of the system at the age of 18. Additionally, families who are involved with CPS could gain Medicaid coverage, which would enable them to have ongoing therapies. Also, it offset jail costs. Most inpatient bed hospital stays would be billed to Medicaid. This would reduce local jail costs, which would allow the resources to be redirected to providing other inmates with behavioral health conditions. There are three exceptional items that we would like to...
Please wrap it up.
Yes, absolutely. There's just three exceptional items that we wanted to say that we would support. The wait list for children and adults, the exceptional item 7 with substance abuse disorders, and then also exceptional item 8, which is housing for individuals with substance abuse disorders and mental health. And thank you so much.
Thank you very much for the testimony.
Appreciate it.